Hi, I'm Marcy Hamilton, Clinical Nursing Director at Allevue UCLA Medical Center. Our patients' lives are in our hands, so we need to ensure that we are providing them the best and most excellent care. The most important thing we can do is to ensure we each are all on the same page regarding our patients' care. This is done primarily by accurate communication among caregivers, plus including the patient in this communication. Because communication errors account for more than 70% of sentinel events, goal number 2 of the Joint Commission's National Patient Safety Goals requires hospitals to improve the effectiveness of communication among caregivers. This requirement further delineates the need for hospitals to implement a standardized approach to handoff communications, including an opportunity to ask and respond to questions. Involving the patient at the bedside also addresses the Joint Commission's goal number 13, which is to encourage the patient's active involvement in their own care as a patient safety strategy. As an RN with more than 40 years of experience, I can state with confidence that the bedside shift report has numerous benefits. I remember many times when I received a report from an outgoing nurse, then went to the bedside to find that something was very different than what was reported to me. Bedside Shift Report prevents this from happening. With Bedside Shift Report, both nurses see the patient together and exchange relevant information, including the plan of care for the patient. The patient and family also get the opportunity to be a part of this process. Bedside Shift Report helps to alleviate some of the stress and anxiety that the patient and his or her family members go through being in this unfamiliar environment that we call a hospital. It builds trust between both the patient and the nurses. Bedside Shift Report closes the sometimes long gap in between getting your report on the patient and then actually meeting him or her for the first time. This collaborative approach has helped to mentor the less experienced nurse and also has improved the experience of the nurses who float to other areas. Patient safety is also improved because safety checks are incorporated into the report, such as making sure the correct IV is running, that the suction machine is at the bedside, or that fall alerts are in place. Potential errors can be caught when both nurses are visualizing what is being reported. I encourage all nurses in all areas to help implement Bedside Shift Report. It's the right thing to do. Thank you.
Okay, our next patient in room 111 is Mary Cruz. She's a 45-year-old Hispanic female, English speaking. She's admitted with chest pain. She has a history of coronary artery disease and hyperlipidemia.
Okay.
She's on telemetry. She's been normal sinus rhythm 80s. Troponins came back negative ×2. Her last troponin was drawn at 0600 this morning. Her next troponin is due at 1400. She's on a heparin drip, 800 units per hour. Her last PT/PTT at 0400 was 14 and 71 seconds, no titration. The next PT/PTT is due at 10 o'clock this morning. She has allergies. She's allergic to aspirin. It causes a rash. Her diet is heart healthy. She has bathroom privileges. She's on fall precaution. And she's been NPO for a stress test this morning. Her most recent vital signs at 0600 were temperature 36.2, pulse 84, respirations 18, blood pressure 112/69, and her O2 sat is 98% on room air. Okay.
Any episodes of chest pain overnight?
No, the patient had no complaints of chest pain, nor did she have any complaints of any pain.
Okay.
I gave her no PRN meds.
Any new orders?
No new orders.
Okay.
Okay? Let's go do our bedside rounding. Okay. Good morning, Ms. Cruz. It's me, Francis, your night shift nurse. Good morning. I'm here with your day shift nurse, Hansel.
Good morning, Ms. Cruz. My name is Hansel. I'm going to be your nurse this morning. I'm going to put my name on the board real quick. Today is Wednesday. The 28th of December. Is that? Hansel. Our nursing attendant will be Anna. And Dr. Keys is still your physician, okay?
And if we may just double check some items on here. Your ID band says here Mary Cruz.
Okay, Mary. Can you tell us when is your birthday?
It's February 14, 1966.
Okay.
Okay.
Great. And we're just gonna verify that everything is current. You have any pain on your IV side? Okay. Everything was changed yesterday, so it's current.
Okay. IV site was inserted yesterday at 2000, and tubing is current as well. Started yesterday at 2100. Heparin drip 25,000 units in 500, running at 800 units an hour, which is 16 cc's an hour.
Okay. And as you see, we have her on the fall precaution. She has her yellow ID band.
Okay.
Oh, Francis, I was gonna ask you, what does this bracelet mean?
Okay. Well, Ms. Cruz, we identified you as a fall precaution because of your past history where you had a syncopal episode. So what we did, we placed the yellow armband for easy identification, as well as a falling star sign behind your bed. So what we do is we encourage you to please, should you need any assistance getting out of bed, just use your call light and we'll help assist you getting out, okay?
Okay.
And the patient's been NPO since midnight for an ETT this morning.
Okay.
What is ETT?
Okay, ETT stands for Exercise Treadmill Test, and also known as a stress test. So we've asked you to be NPO or nothing by mouth since midnight. That means don't drink anything, don't eat anything, okay? And depending on the results, the doctor will write orders to discharge you so you can go home. Okay?
After the test, does that mean that I can eat? Because I'm really hungry.
Yes, after the test you can eat. I'll make sure that you will have the tray available by then. Okay?
Sounds good.
Do you have any other questions, Ms. Cruz?
None.
None right now. Okay. I will go ahead and finish making rounds with Francis. I'll be back within the hour. Feel free to use the call light should you need anything. Myself or Anna, our nursing attendant, will be here to assist you. Okay?
Sounds good.
Thank you so
All
much.
right, thank you.
Have a good day.
You too.
Ms. Cruz is a really nice patient. Do you have any other further questions, Hansel?
No further questions. In the report you mentioned she was NPO, so I'm just going to change our sign up here to NPO.
Okay, thank you.
Thank you.